Welcome back. Today is the first official day of spring, and now is the time people may be thinking about plastic surgery to enhance their look for summer. But do your research ahead of time because there are some overrated procedures out there, and Dr. Jennifer Walden is here with a warning of sorts. She is a plastic surgeon herself. Thank you so much for being here today.
Thank you so much.
So let's talk about some of the procedures that are maybe popular right now, but you need to be wary of.
Right. Well, the first one we should talk about is the Vampire Facelift, which is a highly marketed, short on science procedure where doctors are injecting a person's serum or plasma, which is rich in platelets and some growth factors, minus the blood cells to create a facelifted appearance. And that's really not the case. They've injected some fillers with the serum, and that's really what's plumping the face. It's really just kind of a walletectomy, if you will.
Why is it called a vampire facelift? That name alone is kind of scary.
Yeah, I think that's just kind of a tagline to get people's attention because it's your own plasma that you're using to create the facelift. But it's not a surgical or tried and true facelift technique.
Another one is laser liposuction.
Yes, laser liposuction was a real hot topic in the past 5 or 6 years. Smart lipo, it's called. It involves placing a laser wand underneath the skin to melt the fat, and then traditional liposuction is used to suck the fat out. And basically what we found is this is no better than traditional standard liposuction procedure and can also be more expensive, more time-consuming, and cause some problems like thermal injury or burns to the skin, tissue hardening, and discoloration of the skin over the area that was liposucted.
Which I assume is permanent.
Yeah, some of those things are permanent changes.
Another facelift, the stem cell facelift.
Stem cells is a real hot topic and trend, and basically stem cells is something that is found in our own body's fat, and we've been doing a lot of methods of fat injection to the breasts and the face, and basically the fat can plump out the skin, but surgeons and doctors sometimes tout that skin cells can basically rejuvenate the skin, and we just have not seen that those methods are really tried and true and scientifically tested in multi-centered studies. So it's hard to say that stem cells themselves are causing the skin to look better or to become wrinkle-free.
Another one that might be overrated, foot lifts. Yeah,
foot lifts we hear about, you know, basically the foot is a part of the body that really we shouldn't mess with because it's so heavily relied upon for function. But say shortening the middle toe or Restylane or Juvederm injections to the balls of the feet or even liposuction of the little toe we hear about on the news and on the internet, but really it can alter the way we walk or our gait.
Sure.
It can cause nerve injury, scarring, and chronic pain problems. So most reputable foot surgeons and orthopedic surgeons really advise against cosmetic procedures of the foot.
Stay away from that one. And one final one, fat injections for breasts.
Yeah, fat injections can be used in the breast mainly as an adjunct to reconstructive surgery where we're contouring the reconstructed breast or with implant-related wrinkling or rippling problems. But as a method of enhancement alone, it really has not been shown to be a great way to enhance the breast over 1 cup size, and actually the fat can resorb. One study out of NYU recently showed that over 50% of the fat resorbed within about 4 or 5 months after injection, and that's just not a good long-term result we can live with right now.
Absolutely. New procedure does not always mean best procedure when it comes to plastic surgery.
Absolutely.
Just do your homework. Thank you so much for being here.